Question. A 60-year-old female presents with progressive muscle weakness and wasting, along with difficulties in climbing stairs and getting up from a seated position. On examination, you note proximal muscle weakness and atrophy. Laboratory investigations reveal markedly elevated serum creatine kinase (CK) levels. Electromyography (EMG) shows myopathic changes. Muscle biopsy demonstrates variation in fiber size, endomysial inflammation, and perifascicular atrophy. What is the most likely diagnosis in this case? A. Polymyositis. B. Dermatomyositis. C. Inclusion body myositis. D. Myasthenia gravis. The most likely diagnosis in this case of a 60-year-old female presenting with progressive muscle weakness and wasting, proximal muscle weakness and atrophy, markedly elevated serum creatine kinase (CK) levels, myopathic changes on electromyography (EMG), and muscle biopsy findings of variation in fiber size, endomysial inflammation, and perifascicular atrophy is C. Inclusion body myositis. The clinical presentation and diagnostic findings are indicative of inclusion body myositis. Here's the rationale for choosing this diagnosis. Progressive muscle weakness and wasting. Inclusion body myositis, IBM, is characterized by progressive muscle weakness and wasting, typically affecting the proximal muscles. Elevated serum creatine kinase (CK) levels. Markedly elevated serum creatine kinase (CK) levels are a common finding in IBM and reflect ongoing muscle damage. Myopathic changes on EMG. Electromyography (EMG) showing myopathic changes further supports the diagnosis. Myopathic changes in EMG indicate dysfunction or pathology of the muscle itself. Muscle biopsy findings. Variation in fiber size. IBM is characterized by variability in muscle fiber size. Endomysial inflammation. Inflammation within the endomysium is often seen. Perifascicular atrophy. Perifascicular atrophy is a characteristic histological feature of IBM. Options A, B, and D are less likely in this case. Polymyositis, option A, and dermatomyositis, option B, may present with similar symptoms but typically have distinct histopathological features, such as perivascular inflammation and perifascicular atrophy, which are more characteristic of dermatomyositis. Myasthenia gravis, option D, primarily involves the neuromuscular junction and is characterized by fluctuating muscle weakness, not the progressive muscle wasting and biopsy findings described in this case. In summary, considering the patient's clinical presentation, elevated CK levels, myopathic changes on EMG, and muscle biopsy findings, the most likely diagnosis is inclusion body myositis. This is a chronic, slowly progressive inflammatory muscle disease that primarily affects older adults.